A young mother and her daughter were faced with a challenge. The mother noticed that the daughter seemed to catch colds with quite some frequency, more so than her daycare classmates. She was missing school more. The mother had to take off work to take care of her daughter. It was affecting her work habits as well. She realized that she needed to give this issue with her daughter some attention. Her pediatrician agrees that the amount of colds this child does catch seems to be a bit out of the ordinary, and that there may be underlying conditions they need to further examine to ensure they don't need to put the child on some type of allergy medication, allergy plan, or do some further testing to ensure that she has a healthy immune system. The mother walks out of this appointment with the pediatrician armed with a care plan, some over-the-counter remedies that she can purchase to help keep her daughter comfortable should the colds come back, a prescription for some medication to potentially help with the allergies that may be causing these issues, but also in order to do some follow-up testing with an allergist to specifically pinpoint what may be plaguing her child so they can determine the best plan to help keep the colds at bay and help her have more activity with her friends, and the mother certainly miss less work, be more comfortable. She's also told that she'll receive a phone call from the pediatrician's office within a few days to schedule her follow-up tests with the allergist that they'll be referring her to. Mother goes home, the stack of paperwork lands strategically on the kitchen table. They go about their evening. The next day, an emergency at work pops up. Daughter is feeling well. She's off to daycare. Before you know it, about 10 days have gone by with that stack of paperwork containing her prescription, her orders for follow-up tests, and some at-home remedies, some over-the-counter care that she could have on hand. 10 days goes by. Well, that stack of papers continues to sit there and then possibly becomes used as the canvas for some 2-year-old art projects. Follow-up testing has yet to be scheduled. And the sniffles and the coughs and the sneezing returns at 2 in the morning. And a tear-filled night ensues with the child missing the next day of school and the mother missing the next day of work. It's back in that instant when the daughter is sick again that the mother is reminded of the prescription that she received from her physician, the at-home care plan to help make her daughter more comfortable, and also that follow-up testing they had discussed. She didn't hear back from a pediatrician's office. She didn't schedule those follow-up tests. She also didn't fill the prescription that her pediatrician had provided to her, and she didn't have any of the over-the-counter remedies on hand to dispense to her child that evening. Incompetent nurse at the doctor's office? Probably not. Uncaring mother? Certainly not. We've all been there, right? We know that life gets busy. We forget. Healthcare is about people, and healthcare is dispensed by people. There's a human error factor in healthcare, and this situation is a great example of simple human error. The mother gets busy. Perhaps the nurse who was supposed to have called and scheduled the follow-up exams, the follow-up visit to the allergist, she perhaps got busy, or perhaps that sheet of paper that needed to land in her desk or on her stack of to-dos, maybe it never made its way there. For whatever reason, it was missed. This situation plays out across America every single day. This scenario takes place in our pediatricians' offices with this young mother and this daughter. It takes place in our oncologist offices, in our hospitals. It takes place across the country every day. The challenge we face is not only how do we engage our patients, how do we convince them or drive them to participate in the online tools. Our challenge is how do we use those tools to create a more informed patient. A patient who has more information and more access to take control of their health care and the health care needs of their family. Meaningful use stage 2 can be a bit of a shock or have an adverse effect on many of us healthcare leaders. The word doesn't always have the best taste in our mouth, right? But a specific measure within Meaningful Use Stage 2, Measure 7, it discusses online patient portals and online tools and that role in healthcare and how we distribute and how we deliver healthcare. It states that 50% of our patients need to have been provided access to online tools, to a portal, to be able to see and view their medical records. It also then further states that to attest for this measure, 5% of those patients need to view, they need to download, and they need to transmit this information. They need to access their records. They need to engage through the online portal. When we look at these online tools, I would challenge you to not think about them as an adversary. Instead, let's think about attesting for these online metrics for Measure 7 and Meaningful Use Stage 2. Let's think about this as a method to creating a better patient. If we can provide our patients with the opportunity to view their medical records at their convenience, when they need it, if instead of sending them home with a stack of papers, we, the patient, we are able to log in and see the care plan. We're able to look at that information. We're able to pull our prescriptions or prescribe them right from the portal, make our lives easier and also help our offices attest as well too. If we have those resources at our disposal, we're able to create a more engaged patient. We're able to provide our patients with educational resources as well. We know that 88% of those patient population will go online. They'll turn to Dr. Google to research a physician before they ever possibly make a decision, or to research treatment options, to research symptoms and diseases. If we're using our online tools to better educate our patients, direct them to vetted content, we are creating a better patient. A study by Televox states that 83% of patients in America do not follow orders or plans prescribed or provided to them by their physicians. However, 42% of those patients say they are willing to, they would like to, but what they need is motivation and connection with their physician to carry it out. It sounds great in the office, but how do we apply it at home? Do we take home that stack of paperwork and it makes its way to the table or to the desk, or it lands in our car? Does it ever get where we need it to be so that we can get our prescriptions filled? We can get the medication we need. Where does the information go and what can we do with it? When we look at these online tools, we have at our disposal a way to build a better patient population. More education, more information at their disposal. Let's go back and talk about the mother and daughter that we mentioned a couple moments ago. Let's say for a moment that her physician's office, her pediatrician, had a patient portal. And when she established her daughter as a patient, a nurse sat down with her with a tablet. They sat down, the nurse showed her how to enroll in the portal. They actually did it right there in the office, right in the exam room. The nurse then showed her how to use the tool. The user interfaces that were important to her, where she could find her daughter's prescriptions, her prescription histories, refill information, notes from the physician were right there and available. Anything that they needed to follow up on, follow-up testing, was all right there. They could even set reminders. If that mother was to schedule an appointment or schedule a test or needed to look at her labs, she could receive an email reminder or a notification via text even. Think about how that story of this mother and her daughter might have played out differently Would she have missed scheduling that follow-up test to go see her allergist by 2 weeks? Probably not, because the nurse would have been in at the appointment perhaps, and they would have either scheduled those follow-up tests together, or they would have set a reminder about the appointment and the need for that referral and those follow-up testings. When the daughter fell sick and fell ill at 2 in the morning, the mother would have had access to the prescriptions. It wouldn't have been lost in a stack of papers on the dining room table. She would have known where that information was at 24/7 when she needed it most. And when her daughter was diagnosed with her allergies, her physician's care plan would be right there for her so that she could review it, she could share it with family members, and everyone could help support this 2-year-old and her newfound allergies and the changes she needed to make in her lifestyle. I happen to know that this situation pops up often. Again, across America, it happens every single day from specialty to specialty. But I'm particularly close to this one because this is family. That mother and daughter that we mentioned, that's my sister and my niece. And I watched this played out. I watched it as her pediatrician's office came online with the portal. How it was able to transform my sister's relationship with her pediatrician as a mother, and how she was able to manage what they later found out was a chronic case of allergies that needed to be managed to help my niece live comfortably, breathe comfortably, and avoid those late nights. The technology, the regulations, and the incentives are all there. It's now up to us to not only engage our patients and help them participate and connect with us online, we now must educate them on how to take control of their health and the health of their families. Can we use our online resources to create that better patient? Are we up for the challenge?